Hello everyone, welcome back to my YouTube channel. Today we'll study about some of the important questions related to pharmacology. Here the question is classify penicillins and explain in detail about mechanism of action, pharmacokinetics, preparation and dose, indication, contraindication, drug interactions, adverse effects and rule of nurse. Means it here we are going to study about the classification of penicillin and mechanism of action, pharmacokinetics, preparation, dose, indication and contraindication, drug interactions, as well as the adverse effect and rule of the nurse. First we'll study about the classification of penicillins. Here the penicillins are classified into four types. Those are natural penicillins, semi-synthetic penicillins, extended spectrum penicillins and alpha-lactam inhibitors. So here the natural penicillins are penicillin G. This is also called as an benzyl penicillin. And semi-synthetic penicillins are acid resistance penicillins and a penicillinase. So acid resistance penicillinase again example for this is penicillin V and phenoxymethyl penicillins. And penicillinase here it is a resistant penicillins and methicillin cloxacillins. Example for penicillinase is a resistant penicillinase. Example for resistant penicillins are methicillin and cloxacillins. And next we will say about the extended spectrum penicillins. Extended spectrum penicillins. Here those are divided into three types. Those are aminopenicillin, carboxypenicillin and uridopenicillinase. So here aminopenicillins are example for aminopenicillins are ampicillin, valenticillin and amoxicillin, and carboxypenicillins are carbanicillins and uridopenicillins. Uridopenicillins are again example for this is piperacillin and mesoxillins. And next the alpha-lactam inhibitors. Alpha-lactam inhibitors are clavinic acid and sulbactam and tazobactam. These comes under the alpha-lactamase inhibitors. Next we will see the mechanism of action. Means here the beta-lactam antibiotics. Antibiotics are nothing but the drugs which are used to treat the bacterial infections. Beta-lactam antibiotics. These are going to bind the penicillin binding protein. PBP is nothing but penicillin binding protein. These PBP are going to help for the bacterial cell wall synthesis. Andre PBP main function in the bacterial cell wall synthesis agodakke help ಮಾಡ್ತವೆ. So these are playing a major key role in the synthesis of the bacterial cell wall. Those inhibit the cross linkage of the peptidoglycan and inhibit means it is going to stop the cross linking of the peptidoglycans. Then it leads to the cell wall deficient bacteria. These cell wall deficient bacteria means here there is an absence of cell wall. If there is no cell wall, the bacteria are not going to grow. Okay, and the bacteria cell wall illa anta bacteria berella. So here it undergoes for the lysis. Lysis is nothing but a breakdown. So once a cell wall enadru breakdown aitu the bacteria is going to die. That is bactericidal effect. Bactericidal is nothing but here the bacteria are going to kill the bacterial growth and development. Next we will see about the preparation and the dose. Here the sodium penicillin G. It is present in the form of crystalline penicillins and also it is available in the form of injection 0.52 5 m IM or IV 6 to 12 hours. It is available as a dry powder in a vial and it will be dissolved in a sterile water at the time of injection. Means it is available in the form of the powder. It should be added in the distilled waters or in sterile waters. And repository penicillins G are injection. These are insoluble salt of PNG or the penicillin G which must be given by the deep IM. So these are used by the IM as well as the IV. Here it is also used for the IM and only IM, and there is no IV injections. So injection they release the penicillin G slowly at the site of injection and which then meets the same page as soluble penicillin G. Okay, these are the preparation and the dose of the penicillin G. Preparation of dose: broken penicillin G injection 0.5 to 1 mu, or it is the interval for this is 12 to 24 hours as a aqueous suspension, means it is available in the form of suspensions, and plasma concentrations attained are lower but are sustained for the 12 to 24 hours. Procaine penicillin G 0.5 to 1 mu dry powder in a vial, means it is available in the form of dry powder. This powder you should add with sterile water or the distilled water. And if you added both the injections powder as well as in a distilled water, and there may be a present formation of the suspension, so that suspension we are going to inject to the patients. And here the fortified procaine penicillin G injection contains 3 lakh U procaine penicillin and 1 lakh U sodium penicillins. Okay, next is benzathine penicillin G, means it is administered 0.6 to 2.4 mu IM every 2 to 4 weeks, means the duration of injection should be administered 2 to 4 weeks as an aqueous suspension, means it releases the penicillin extremely slowly and plasma concentrations are very low, but the remaining effect for the prophylactic purpose for up to 4 weeks, means once you administer this penicillin for the period of the 2 to 4 weeks, the effect should be present in the human body up to the 4 weeks. Okay, these are the preparation of the penicillin doses. And next we will see the indications. Indications are nothing but in which condition you should administer the penicillin. Those are streptococcal infection. The streptococcal infections are nothing but the infections which caused by the streptococcal bacteria. Example for this is a common cold, rhinitis, and other skin infections. These are comes under the streptococcal infections. And next is pneumococcal infections. Pneumococcal infections are the infections which caused by the pneumococcus, means pneumonia. And meningococcal infections: gonorrhea, syphilis, diphtheria, tetanus, and gas gangrene, anthrax, actinomycosis, rat bite arrow fever, and rheumatic fever, and bacterial endocarditis and granulocytosis. These are the indications, means in these conditions we should administer the penicillins. And next we'll see the contraindication, means in which conditions you should not administer the penicillin. Here the some of the injections of the penicillin are contraindicated in some disease conditions. Those are these are indicated during the person who is having the hypersensitivity reaction towards the penicillin, or during pregnancy and lactation. See the drug interactions. Next we see the drug interactions, that is means when you administer these penicillin drugs, it should be interact with other drugs, means the combinations of drugs. Here the drugs like aspirin, phenylbutazone, sulfonamides, indomethacin, thiazide increases the half-life of the penicillin by competing with tubal secretions, means the penicillin should be administered with all these drugs. And next, penicillin decreases the effectiveness of oral contraceptives. When the woman is taking the oral contraceptives, we should not administer the penicillin, because these oral contraceptives are going to decrease the concentration of the penicillin, and the penicillin the concentration ಕಮ್ಮಿ ಮಾಡುತ್ತೆ oral contraceptives ತಗೋತಿದ್ರೆ. And next, the adverse effect are hypersensitivity reaction, pain at the site of injection, confusion, muscle twitching, convulsions, and coma. These are the more common adverse effect and the side effect of the penicillin. Here the hypersensitivity reaction, pain at the site of injection, confusion, muscle twitching, and convulsions, and coma. Next we will see the most important, that is pharmacokinetics. Pharmacokinetics, as you know, the pharmacokinetics, it includes the 4 steps, that is absorption, distribution, metabolism, and excretion. Mainly the absorption occurs in oral cavity, and the distribution it occurs through the blood and other body fluids, and the metabolism it mainly occurs in the liver, and the excretion it occurs in the kidneys, and it is excreted to the urines. This is the pharmacokinetics of the penicillin. And next we'll see the rule of nurse, means the rules and responsibilities of the nurse before and after administration of the insulin. Here the some of the rules are: when the before administrations of the drug, the nurse should know the complete history or the health status of the patient, means, and also she should know about the 10 rights of the drug administrations. And if the patient having any hypersensitivity reaction, she should not administer the drugs. And also the nurse should know about the contraceptive history of the woman. And also these are contraindicated for the nurse should know about the indications and the contraindications, means in which condition we should administer the penicillin and in which conditions we should not administer or use the penicillins.